In China, hospitals are full of children, sick with respiratory illnesses, including pneumonia. Crowded waiting rooms, beds lining hallways. It feels all too familiar. On the 21st of November, an alert was issued by public disease surveillance system, ProMed, warning of an undiagnosed pneumonia in China. The same system that alerted global scientists to COVID in 2019.
What we are mainly seeing is mild to moderate illness. However, because China doesn't have a general practice system, many of those children are ending up in hospital for management.
And China is calling for calm, blaming the rise in cases on the lifting of COVID restrictions and changes of the season, insisting they have found no unusual or novel viruses.
I think that the pandemic 2.0 is not there yet.
And the World Health Organization agrees.
Chinese surveillance and hospital systems report that the clinical manifestations are caused by known pathogens in circulation.
Because China has been in a form of lockdown for most of the last 3 years, these kids have a significant immunity gap, and unfortunately they're just getting hit with every single re-emerging virus.
But now there are reports of mysterious cases of childhood pneumonia spreading across Europe too, in Denmark, Sweden and the Netherlands. Ohio, the first state in the US to report an outbreak. In Warren County, 145 children have been diagnosed with pneumonia since August. Authorities trying to ease growing concern.
We do not believe this is a new or novel pathogen. We believe this is all existing.
So, is it too soon to push the pandemic panic button?
In any winter season, we often see clusters or pockets of respiratory illnesses. When we start looking for patterns, sometimes patterns will seem or appear to exist, but it's very different to what we saw during COVID.
Well, Dr. Paul Griffin is here to give us his take on what's going on. Now, Paul, a lot of people, despite all those assurances we've just heard, are feeling kind of freaked. Should we be?
Look, I completely understand why people are concerned. I mean, seeing that ProMed message with exactly the same subject heading as 2019 was pretty concerning. But in short, we don't need to be concerned. What this does appear to be is a combination of known, existing, both viral and bacterial pathogens that have just been impacted by our COVID mitigating strategies, and obviously those being removed, this being the first full winter where there's been none of those strategies employed. So while it certainly means we need to pay close attention and observe and wait for more information and not get complacent, it doesn't appear that there's any cause for alarm.
So in the early days from China, we saw no real transparency over SARS going back in history a little bit, or in the early days of COVID. How satisfied can we be that China has been completely transparent this time around?
Look, I think it's clear there was an opportunity to be more cooperative and transparent perhaps last time, but I think it's known the world's watching there now. And if we look at the correspondence between the WHO and China, China responded in the very short time frame that was requested by the WHO. Within a day, they've shared information, both clinical and laboratory. So I think this time we're going to have a greater degree of assurance about the information that we're seeing.
So what's making these kids so sick then?
Look, I think it's complicated. You know, if we look at the type of viruses, things like the flu and RSV, they typically cause more severe disease in children and cause more infections in children. And Mycoplasma pneumoniae, the bacteria that's also involved, is similar. Of course, COVID is still around. And then there's some other issues that are making this more challenging, including the high rates of antimicrobial resistance in that bacterial germ, that Mycoplasma germ. So some of them, or a lot of them, aren't responding to antibiotics. So it's complicated, but I think we're getting some more information and getting some really reassuring information coming out.
Doc, should we be concerned for the elderly with this one?
Look, I think we always need to be concerned about the elderly with these sorts of viruses. I mean, they're a very vulnerable group and, you know, we're really lucky that we've got a lot of great tools to protect them. Flu vaccines, we've got a new COVID vaccine in a small number of weeks, and we're getting vaccines for RSV as well. If they remain in fridges, though, we're not protecting those people. So we need to, as I say, not get complacent and make sure we protect our vulnerable population, or those who are vulnerable in our population, with all of our available tools.
OK, so, Doctor, as a public health expert, on a scale of 1 to 10, how worried should we be that WA is going to close its borders again?
Look, maybe we should be alert but not alarmed. But, look, I think we just need to pay close attention to these sort of situations. And it really highlights the strength of our public health monitoring systems these days, that, you know, the whole world finds out about these sorts of issues really quickly, and then we can get more information and respond accordingly if we need to.
Well, I feel more reassured. Thank you so much for that, Dr. Paul.
Pleasure.